All right. Good afternoon, everyone. We are going to adjourn.
That was fast.
Already,
Yeah.
meeting's over. We're going to call to order our June 25th, 2026 Regional Opioid Abatement Council Region 2 meeting. It is 2 o'clock, right on the money. Let's do a roll call first for voting members. Estes Park. Here. City of Loveland.
Here.
City of Fort Collins.
Here.
Larimer County.
Here.
Thank you, Commissioner. Representing the Board of Health, myself, Tom Gonzalez, I'm here, and we do have an excused absence from the town of Wellington. Brian is excused today, so we're missing one voting member. Okay, we'll move on. Anybody would like to make public comment to the council? Seeing none, we'll close that. We'll move on to agenda item 4, which is update on the Larimer County Sheriff's Office contract review. I'll turn that over.
Chair, Mr. Chair, can we approve the minutes first?
Well, I'm having a rough day already. I'm skipping stuff around. Yes, ma'am.
Yes,
Let's do that. Let's not jump.
Mr. Chair, I'd like to move to approve the minutes as presented, please. Thank you.
Thank you for that.
I will second that motion.
Got a motion and a second regarding the May 28 minutes. Does anybody oppose that motion? That passes unanimously. Now I'm going to slow down. We're going to go from 3 to 4, not 2 to 4 or 5. I'll turn over to Rupa.
Yeah. So this is starting on page 10 in your packets. So from my understanding, back in December of 2025, we were notified by the Sheriff's Office that they no longer had a partnership with Summit Stone for their application, their grant application that they made to this council. And that partnership was discontinued in October of 2025. And so the question from this council was, do we ask for the money back for that 1 month from the Sheriff's Office, or is there, or did the Sheriff's Office use the money that is just another approved use of the opioid funds? So this is the letter that the sheriff provided, and indicating that it was used still for their crisis response program. So I would recommend that we accept the letter and close this case out.
Thank you, Rupa.
Chair, I would like to make a recommendation that we accept this letter, consider this matter resolved, and move on from this, please. My motion.
There's a motion.
I will second.
We have a second from Rupa. Thank you. All those in favor of the motion signal by aye.
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 Does anybody oppose the motion?
Aye.
The one opposed, and that,
Well, was that an aye?
was that an aye or an opposed, just to make sure?
Councilmember Cortez, did you mean to say you oppose the motion, or do you say you want to support the motion?
No, I'm supporting the motion.
Thank you for the clarification. Appreciate it. That motion passes unanimously. Thank you. All right, we're going to move on to agenda item 5. We have quite a bit under grant administration. Several year 3, that's 2025, 2026 reports. You all recall these are our final reports. We give the grantees 5 minutes to give their report and then 5 minutes for questions due to the sheer number of the reports that are being given today. So with that, we'll move right on to Yarrow Collective's final report. And we'll welcome Yarrow Collective to the council. Okay.
Hello, it's just me today.
Well,
So,
great.
yeah. And I've got some notes that I can do both parts. So, yeah, thank you. Again, my name is Gina. I use she and her pronouns, and I am the Director of Finance and Operations at Yarrow. So, can you go to the next slide? And we took the advice and just are going to jump directly into our objectives. I think most of y'all kind of know who we are and what we do, so we just wanted to get straight to it. So yes, our objective one, was to increase those like one-on-one hours or hours for peer support, both for our drop-in peer support as well as for our, one-on-one peer support in the Larimer County Jail. So as you can see here, served lots of folks, both, unduplicated and duplicated, which I think is like part of the really important aspect is that folks keep returning, right? And specifically with our Larimer County Jail peer supporter was averaging a minimum of about 8 sessions over about 3 months with each participant. So, you know, folks in the Larimer County Jail might be kind of in and out quickly, but our peer supporter was making sure that he was able to really connect with them as many times as possible before they were released. Next one. This one is objective 2 for our pro-social events, which this is our, I guess, second time. This was from year 2, right?
This is for year 3.
Was it for year 3? Okay, I'm like, the time is flying, okay. Yeah, so, we had this previously in our previous grant, and it was a big part of our community, and so hosted total of 10 events. I realized when I was looking over my notes that it is actually 525 duplicated. Not unduplicated individuals, but lots of folks still coming back to our programming. And of these folks, a majority of them really reported a powerful sense of like belonging at these events, with over 73% giving the highest possible rating to the feeling of being included and at home at these events. The other part of this as well is that of our participants, 86% identify as belonging to a marginalized identity. So really reaching lots of folks who not only could be using our services, but that we want to be spending time with. Next slide. Next is our drop-in peer support space. So here's our space. Here's our community area where folks hang out, do arts and crafts, listen to music, have conversations. And I want to also note that these numbers here actually are from August 25 through March, for the time it took us to actually hire somebody into this position, and then to get the space up and running and going. There was a little bit of time in between there. Of those folks, 58% identified as living with a disability, and 92% as a part of the LGBTQIA+ community. So really wanted to make sure that we were creating like a sense of community, love, emotional safety, as much comfort as we can for folks who might feel inherently uncomfortable. The other part of this was that our staff completed a 8-week in-person embodied ethics course, which really helped us to just revisit our like relationship with power, our relationship with our community members. As somebody with a like lived experience, I am also a part of the community that we serve. And so really being able to step back and take the time to really look at the power that we hold as peer supporters, those ethics, values, all of those things. Next slide. This was part of our educational reducing stigma efforts, had some social media post campaigns, as well as distributing over, I want to say it was over 800 printed postcards to like the library to our community events, things that we were tabling and all kinds of the stuff. So, next. Our last objective was the parenting group, where we really focused on creating a space for folks that were like learning how to, I don't want to say learning how to parent, but just learning how to effectively like get through generational like parenting, really what it feels like to have like some self-care, those skills. One mother had shared some feedback that peer support has empowered my decision-making, transportation, job search assistance, emergency support for my baby, recovery support for substance use challenges, and constant comfort and strength. Next. So this was just our overall numbers here. 1,204 duplicated participants, 259 unduplicated, over 1,000 naloxone kits, 1,683 fentanyl testing strips, and then as well as 524 wound care kits. And then this is just a look at who we are serving overall across all of this grant. Yeah, lots of folks with different marginalized identities. So with 86% having at least one, which is exactly what Yara was about, is reaching folks who may have trouble accessing services otherwise. This is just a plug for our groups, because always. Yeah, and I think the last one is just our contact information.
Fantastic. Questions?
Jody had one.
Commissioner, you have your hand up?
I just put it in the chat. Sorry, I'm trying to, I haven't been on Zoom a lot in the last 3 weeks, so this is trying to get my skills back up. I'm curious if you could go back. And first, I'm sorry, I can't see you in person. Who is the person presenting? I didn't hear that in the beginning. I apologize.
That's okay, it's Gina.
And can you remind me of your position again, Gina?
Director of Finance and Operations.
Okay, thank you. If you can go back a few slides, I'm trying to understand because the beginning slide, one of the beginning slides, not a couple more, please. Thank you. Another one. Yeah, back, that one with the unduplicated. That one. So I'm kind of trying to understand, are these different objectives and different programs? Because you said the 525 should not have been unduplicated there, should have been duplicated.
Correct.
And then, yeah, and so that, so that should be duplicated. So how many really are the individuals that you're seeing there that are going to all these events?
So I think on that, the overall numbers, I think it said 259 unduplicated across this grant. And so, yeah, lots of folks are return. For these events specifically, it's really hard for us to specifically figure out who is coming back consistently and who isn't, as we don't have like a check-in. We don't have like all of our programming is anonymous. We don't ask people to fill out a check-in form or anything like that. And so yes, but it should have been duplicated individuals here, with the total amount over all of our programming being the 259.
And then when the other slide you said 1,000 duplicated and then 529, if you don't mind, Mr. Chair. And so if you're not tracking, I see you probably can track very well the naloxone kits and the fentanyl and all of that. But if you're not gathering information and you're trying to track duplication or non-duplication, and then you're talking about opioid use versus substance abuse disorder, how are you? Because these grants, we're being also audited and also at the federal level, and a lot of things are changing at the federal level where they're getting pretty, really scrutinizing a lot of things. I'm wondering, how do we know, since this is opioid abatement focused, that these are really really stressing to be used for opioid use disorder, and how, you know, since you're not quite sure because you're not tracking, I'm wondering how we know for sure the numbers, since we have to kind of have metrics and outcomes and meaning objectives. I'm curious about that and how that's tracked. Thank you.
Yeah, absolutely. And I will say the events are the hardest part for us to find out duplicated versus unduplicated. Our other programming, because we're meeting with folks one-on-one, it's very easy for us to know that difference. As far as like opioid use disorder and substance use disorder, we are seeing that fentanyl is in everything. Opiates are in everything. A lot of folks are using opiates as well as other substances. And so we are very intentional about reducing barriers. And a majority of the folks that we serve, when we have them, you know, even ask for just the anonymous demographic form, there is hesitation, especially these folks who really have identities that are targeted, to be frank. And so because we don't do that, it's hard for us to know exactly that every single person has opioid use disorder. But what I will say is that we are hearing that, yeah, there, and you can see by like the naloxone kits and the fentanyl testing strips that, yeah, these are folks that are definitely struggling with OUD, SUD. We also don't-
I'm sorry to interrupt. Go ahead. Sorry.
I was just saying, we also don't track like co-occurring, right? Like some of these folks are also dealing with like mental health and that type of stuff.
Sure.
Yeah.
If I might, Mr. Chair, I just want to, you know, I understand, I'm certainly understanding why and kind of your conditions that you have, but I mean, for us as an entity that have to report and have metrics and numbers and showing how the money was spent, you know, we have to ask these questions because we need to show they were used how they were intended, and also that we're getting the outcomes. And so I just want to kind of make note of that, because we can't, it's this money, we only have a limited finite amount of money and a finite amount of time for this, and we just want to make sure that we can show that the money was used how it was intended and that we are getting really good outcomes. So I just wanted to kind of make note of that. I know it's really hard and people are reluctant, but as much as we all can ask and get those metrics and that data, I think it's really important. So thank you for letting me share that.
Thank you. Any other questions? We are a little over time. If there are pressing questions, motion to accept the final report.
I move to accept the final report from Mara.
There's a motion and second. Any conversation, discussion?
There was a comment on Zoom from Z.
Okay.
People are self-identifying as having lived experience with opioid use disorder on our surveys.
Was that a comment or a question, Z?
And those will probably answer.
Yeah, that was a response to Commissioner Jolly. Our surveys actually ask people if they've accessed specific services within the past year. So we are asking people if they've attended inpatient treatment, outpatient treatment, SUD treatment, syringe access programs, XYZ. And then we also are asking them about their barriers in very specific ways. So from what I understand, the way the data is aggregated is that they're looking at the qualitative responses and then making those connections without asking people to deliberately self-identify. So if a person is filling out a survey and they have access to like a Narcan kit or a care kit, and they've indicated that they went to opioid treatment, then we know that they have met the criteria for opioid substance use disorder. I hope that makes sense.
Thank you.
Yeah, I'll also just throw out there as like somebody who's primary drug of choice was opiates. I've never been actually diagnosed with that, and also don't identify as opioid use disorder specific, because pretty much whatever worked. Anyways, yeah, thank you.
All right. Does anybody oppose the motion? Hearing none, that passes unanimously. Thank you for your work. Appreciate you. All right, we're moving right along. The Red Point Center final report.
move if I use this little corner, I just can't access to things. All right, perfect. Hi, thank you. I'm Alex Moore. I'm the Chief of Staff at Red Point Center. And I did put in some, it's okay, take your time. So it's there. And I'll just kind of talk a little bit about what the Red Point Center does. So we are a substance use and mental health treatment facility. We do outpatient services in a bunch of different places. We have 7 locations, but this is specific to our Larimer County location in Fort Collins. And the grant funds that were given to us supported client scholarships exclusively. So clients that were either underinsured or uninsured entirely. So by underinsured, we mean that insurance cuts off care before they're actually done with the recommended treatment for substance use disorder or mental health treatment, or those who are entirely uninsured or are unable to meet their deductible or co-insurance requirements that their insurance sets. So making a barrier for them to actually access the care that they need and support that they need. Here, I won't go over this in a ton of detail unless anyone has any questions at the end. These are just the various levels of care that we offer as an organization. The partial hospitalization program, or PHP is the acronym, is about 25 hours of group therapy per week, plus some individual services, drug testing, psychiatric services, medication management, if needed, and family support. And that is, everything we do is on an outpatient basis, but that's the highest level of care. The intensive outpatient program is about 9 hours. It is 9 hours of therapy, group therapy per week, plus those additional services involved in PHP as well. And then as a step down option, we don't offer our outpatient program as an initial level of care, but for clients that have completed our intensive outpatient, we do offer step down support with just outpatient care, which is 1 hour of group weekly, and then individual therapy, still doing some drug testing services throughout all levels of care, and those other individual services mentioned previously. Okay, so through the grant funds, we were able to serve 33 clients. 73% of those clients were women, 24% were pregnant or parenting clients, and then 33% identified as LGBTQ+. We had a bunch of different sources. So some of those were Medicaid clients, 27%, which we found, unfortunately with Medicaid, they are often cutting off services far before we believe clinically that the clients are ready to step down. They're giving, usually the recommended amount of time is 90 days at minimum to see a long behavior change and have that be sustainable. And often we're seeing Medicaid cut off around 6 weeks or sometimes even less. So whereas other insurances are giving more time. So there are often times where we would not receive any more authorization for services, and grant funds were able to step in and support the client to complete their level of care that they wanted to be in as well. Private insurance is a large portion as well. This is often, though people can't afford their deductibles, their out-of-pocket maximums, that insurance requires them to pay for services. So that's very helpful in those cases. And then 12% were uninsured folks that have neither Medicaid nor private insurance were able to access resources. So 100% of our clients received co-occurring mental health treatment. That is something we do with every single client that walks through our doors. Substance use is really never by itself. There's always something going on underneath that, some co-occurring mental health disorder. So we are always assessing for that and treating the whole person. About 45% received medication-assisted treatment. So we do have medical staff that
either works with clients if they don't have an outside provider, or they will, our staff will coordinate with the outside provider to just track and make sure that they are receiving any medication-assisted treatment services they might need. And then the average of 56 therapeutic units per client, it did really vary based off of the client's needs. And whether they started with PHP and then went into IOP and then OP, or maybe just completed IOP, but that was the average. That includes groups and individual sessions. We had 71% complete the program successfully among the clients that had discharged during the grant period. At the end of the grant period, we still had 5 clients that were still in active treatment and have not completed care with us just yet. We have 100% documented family involvement with all clients. This is a really crucial part of our program. We have our therapists do weekly family contact, reaching out to the client's designated family or chosen family to loop them into their treatment. And then we also offer during the grant period, we offer 24 family education and support groups. This is something that we offer to all support network of our clients to be able to get some skills for themselves and to be able to support their loved one. And so we did have at the end of the year $714 left because the clients that we were working with that needed and qualified for these funds, we just came to the end of our time at March 31st and still had that 714 left over. So we would request to be able to utilize that for some of the treatment that was already rendered in April. So just extending it to the end of April. Same exact use, just scholarship funding for clients. That's most of my presentation, but I'm happy to. I had my 5 minutes. Do I need
Great.
Okay. Of course.
Questions, comments? See, with the motion, if approve the final report, if the council desires, it would also include the $714 of carryover to make sure that's included in that motion as well. So anybody want to make that motion?
I'll make the
Make that
motion.
motion. I'm sorry. Go ahead and make the motion, Mr. Mayor. I'll second it.
I'll move to accept the final report, including the carryover of the 714.
I'll second that.
We have a motion and second. Further conversation? Hearing none.
I just have a quick question coming out of Loveland.
Yeah, Zeke.
So because we haven't really, I guess, denied a final report since I've been on this commission, what happens if the council were to deny the final report?
I think you raise a good question. We could certainly, what it would be, they've already received the funding, but it would be, at least there's some concerns with the final report because we do the 6 months, so we approve the 6 month. Then in between that 6 month to the final, there would have been some concerns, maybe lack of reporting, maybe lack of follow through that we would then have to address and work through with legal counsel on it would be probably the process. Anybody else want to add their thoughts? But that would be really the mechanism if the council had some concerns with that final report, at least how the funding was utilized.
That's basically how I see it. If we saw issues that any one of us was questioning, conceivably could deny the report and ask for a return trip or else an updated report with the gaps filled or errors corrected.
Correct.
Understood. Yep, that's what I was looking for, is just that what is basically the recourse when we would deny a final report if the work has already been done for the last 6 months.
Excellent question, Zeke. I appreciate that for clarification purposes.
Mr. Chair, maybe this would be good information since we still have some newer members on the board. I think we had sent out those grant applications that spells out those details in the grant applications and some of the bylaws. And so maybe we can resend that out to everyone so they can relook at that information and understand the mechanisms for the 6 month and the final report. I think some of that spelled out. Maybe that'd be a good tool for all of us to have on hand for meetings in the future. Thank you.
Yeah, thank you.
Yeah, obviously at the time of approval of the grant, you in effect vetted and ask all the questions that make you feel, okay, this is a good place to grant it. So at the end, unless there's some big gap. Anyway, enough said.
Yeah. All right. Anybody oppose that motion? Hearing none, that passes unanimously. Thank you for your work. That's great work. Thank you. Okay. White House final report. Welcome.
Always get soda. I'm good until I get up here. I'm so nervous. There are not very many of you today, but so it makes it a little bit better. I'm Jennifer Stover. I'm the program and fundraising specialist at Lighthouse. So yeah, thanks for having us back to do our final report. Next slide, please. So for those of you that don't know, we're a supportive recovery housing program. Over the funding term, we served 127 residents and we brought in 89 new intakes. Let's see, 41 residents listed opioids, primarily fentanyl, as their drug of choice. And 94% of those residents with opioid use disorder were on some kind of medication, generally Suboxone. 100% of residents received MAT education as well as a needs assessment at time of intake. And grant funding allowed us to really expand staffing and provide more support services to people in our program. Next slide, please. So we provided a lot of expanded capacity and we have some major accomplishments listed. As I said, we hired a full-time intake specialist. We did that within 30 days of receiving funding, and we increased my hours to full-time, which allowed us to improve responsiveness to applicants in crisis, which is most of them, and increase in-house support services like performing needs assessments like we didn't before, providing MAP education, more resource navigation, and more employment assistance. Some of our major accomplishments over the funding term, we opened our first women's recovery house. We have 10 beds. We opened in January of 2026 and increased the total number of residents served in intakes compared to prior years. We also developed a referral network with 36 community partners. Next slide, please. Just some photos, because you guys haven't been there. That's our main men's house. We have 32 people, interior and exterior, and that's our new women's house, and an interior shot of that. So 32 inside, so 42 beds between those houses. So a little bit about housing stability. A lot of the funding went to scholarships. We provided 23 first-month scholarships for ROAC, an additional, I believe, 30 from other funding sources, so over 50 first-month scholarships, and 74 ongoing, which means needs-based while someone's in the program. If they need a scholarship, they apply. And we provided 74 of those. That allowed us to have zero removal students to inability to pay for program fees. Because of the extra staffing, we were able to help with more employment assistance. We created over 50 resumes and cover letters. We had 73% of our residents employed within 30 days, 80% within 60, and 87 within 90 days of entering our program. Some of our major grant goals that we exceeded, we did more scholarships than our goal, as well as more furniture replacements, and our employment goal exceeded. Next slide, please. So that was most of our final report. I just wanted to go over a little bit about current community need. With Harvest Farm closing, we've had a lot more applications. We've had over 20 of their residents apply for our program. As of today, we're actually bringing in a 5th person, but we are operating at capacity. We have 15 people on our wait list. So there's definitely a huge need for housing. I would ask that with them no longer receiving funding, that you consider putting it into a housing program. We are expanding. We're opening a 15, well, not opening, taking over a 15-bed house in Loveland. The ARC will soon be the Lighthouse. So we'll have 15 more beds. We have a women's house capital campaign underway. We've raised about $200,000 for a down payment. But we would really appreciate being able to present for additional funding to help with all of this expanded capacity, maybe a matching grant for a down payment for a women's house, or additional staffing scholarship needs with the growing capacity in our program. Next slide is just some pictures of some of the men and women in recovery in our houses. And yeah, next slide, that's it. Questions?
Questions from the council? What's the timing on that 15?
Within the next 30 days or so, it's gonna be pretty soon.
And that's in Loveland, correct?
Yeah.
Yes, Commissioner.
I'd like to, thank you, Mr. Chair. I think that we should keep those two matters separate. And I think that we should just approve the final report and then have a discussion on what we want to do with the harvesters. We haven't even had a chance to kind of discuss that. And I want to remind us as a board or a council that we had another agency that asked us to help with a down payment for buying a house for a recovery. And our attorneys and others felt that was not appropriate use of the opiate money and probably would not pass through the kind of the what the AG's office and the national would allow. So I just wanted to say we had that discussion before with the previous one and make sure. So if we've denied that one, I'm feeling we probably would have to deny a down payment assistance as well for this one. So I just want to remind everyone of that. And I don't think those conditions have changed. And I think that since we denied one, that would have to have a bigger discussion about what that looks like. So, but I would, unless there's other questions, certainly, I think should be considered, the request considered separately from just the final report, so we can have a larger discussion about what we do with that funding overall. So I just wanted to share that. So if there's no other questions, I'll make a motion just to approve the final report as presented without the other request for diverting the other funds to them. So that's my motion if it's accepted. Thank you.
Second that.
We have a motion second. Any further conversation? I have one question. What or any pushback are you getting in with nearby neighbors when you're looking at a home for recovery?
Right, and we haven't had any, honestly. It's been great. I mean, our neighbors have been love us. They donate to our fundraisers and yeah, so it's been really good so far.
Wonderful news. I didn't know. Okay, good. Any other conversation? Anybody opposed the motion? None, it passes unanimously. Thank you for your work. That's great. Okay. Next on, we've got partners' final report.
Again. I'm Shana Cafalas. I am the program director with Partners. Thanks for having me back. I know I was here a few months ago for our application for this next cycle, so some of this might be old information for you all, but just wanted to go through some of our final report information. You can go ahead and go to this next slide, please. All right, so our total funded amount for this prior funding year was $158,300. This was the breakdown of that money. We were able to utilize the full budget. We were able to utilize it within the categories, no major changes to anything. So our program, as a reminder, is that youth mentoring and substance abuse prevention. And our model is pretty set in stone at this point. So generally our budgeting categories stay the same. One thing of note is that we did have that professional development and training money set aside. This was something that our staff expressed a lot of appreciation about. Not a lot of funders will provide professional development money, dollars that are earmarked directly toward that. And we were able to provide the opportunity for our staff to each have an allotment in which they were able to figure out what professional development opportunities fit their individual needs, both as people and then in their specific roles. And so folks were really excited about being able to use those dollars. You can go ahead and go to that next slide. All right, so our first objective was about our mentoring youth. We aimed to serve 780 youth in Larimer County. So that is throughout kind of all the areas in Larimer, including Estes Park and Loveland and some of the smaller surrounding towns like Bellevue, Wellington, all the way, up to Berthoud. So we were able to serve 694. So we realized that we did hit below that goal. When we had written the grant, so primarily this is due to timing. When we had written it, we were hoping that the grant would be kind of that calendar year starting in January. So that's where you can see that discrepancy in numbers a bit, just based on our programmatic timing. And then we have the breakdown here of the youth who we serve, so community-based mentoring youth, school-based, and prevention education. Prevention education was our highest reaching program. That is the one in which we're able to provide 10 to 12 week curriculums to full classes of students. So we're able to reach more kids there. Whereas our mentoring is one-on-one, and we generally rely on volunteers and CSU interns. So capacity is a little bit smaller there. All right. So our second goal was to provide at least 12 group pro-social activities. So this is something that we dedicate ourselves to doing throughout the year, and throughout our offices, we were actually able to offer 40 group activities. So we were really proud of that. We really were able to pick it up. We offered some cooking classes, taekwondo, we did hiking, bowling, rock climbing. Additionally, we did more kind of low-key stuff like board game nights and art nights at the office. And then we did a couple of family nights as well. So one of those was an ice cream social, which we're actually lucky enough to be able to do again next month. So we're excited to engage the full families of the youth who we serve in that. All right, and then our next objective was regarding our surveys. So just seeing those outcomes. Generally in prevention, we see that maintenance and improvement are both considered successes. A lot of times we're working with youth who face a variety of risk factors in their lives. And so baseline, we can predict that they might decrease in certain areas. So if we're seeing maintenance, that's a success. We were able to see 75% of community-based youth, 62% of school-based youth, and 65% of prevention education youth showing maintenance or increase in their perception of risk of alcohol, tobacco, and other drugs. Again, seeing that maintenance and increase is great, particularly knowing that as kids get older, their perception of risk might change a little bit as they're seeing more or perceiving more community norms around substance use. Oh, sorry, if you want to just go back real quick. Awesome. Yes, so then we have these other two as well around decision-making skills, and then bonding to adults, of course, is an important one for us with our mentoring youth. So yeah, that is all. Those are all of our objectives that we had outlined, met them primarily other than that one youth served number. Any questions I can answer for you?
Questions from the council? I just want to say that was a great presentation.
Thank you. Try to keep it nice and concise for you this time.
Anybody like to make a motion?
I'll move to accept the final report from PARC.
I'll second that.
We have a motion and second. Any further conversation? Hearing none, that passes unanimously. I'm sorry, does anybody oppose the motion? Hearing none, that passes unanimously. Thank you.
Thank you so much.
All right, Fort Collins Rescue Mission, final report. Bless you.
All right. So I want to get in and go over the final report, our stats, our metrics, all of which were very encouraging again. But I feel like it'd be remiss not to acknowledge the elephant in the room, and that is, of course, that Harvest Farm is closing down on our last day of operating it as it has operated for the last 37 years is going to be on June 30th. This was a deeply difficult decision for us and our entire organization. It's something that was incredibly difficult for certainly myself and Seth, who have been representing the organization up here with ROAC, but also in the community for a very long time. And yet, I will say and believe it's important to acknowledge that for the well-being of our organization's long-term viability and our ability to serve those most vulnerable in our community, this was the decision that we needed to make. So I'm deeply saddened, of course, by this decision, this very difficult decision, and incredibly grateful for 37 years of changing lives here in Northern Colorado, for being a pillar of the community and addiction recovery from the nonprofit side and serving those who couldn't afford treatment otherwise. To have served thousands of individuals is a real blessing and something that I'm personally deeply grateful that we're able to do, as are our staff, who did an incredible job. And I know that 5 minutes is really important when we're doing these things, so I'll continue, okay? So grant award, as we have, we're good at spending the money and the resources provided. We did again so on this funding stream. Go to the next slide, please. So some key items. Again, this is for the grant funded period that you all funded as opposed to a typical fiscal year or calendar year that we operate on. So we had 64 individuals graduate, 96 men secured more stable housing than they had before coming to us, 79 had paying jobs, 134 connected with mental health care. This includes counseling, psychiatric care, medically assisted treatment, all of which were provided on site at Harvest Farm for those in need of that care. Served over 165 individuals. These are the two that I think they're all significant, but for the ROAC are incredibly significant. And that's 54 men came from Fort Collins Rescue Mission. The 24 increase since our November report. When we get to the next slide, you'll see the overall increase that we've been able to have on those most vulnerable in our community as a result of the ROAC support. And then lastly, ROAC helped us with a number of things. One of those was certainly data collection and the significance of data in reporting. So we had, of those men we served, so of those 165, 76 reported a history of opioid drug use and directly confirmed that at intake and admissions. Next slide, please. So this is really exciting. So Harvest Farm started with the intent of serving those most vulnerable. We started with the intent of serving individuals experiencing homelessness, knowing that same thing we knew 37 years ago that we know today, which is that those battling homelessness and experiencing homelessness often struggle with addiction and substance abuse. So we desperately wanted to reinvigorate that desire to serve the most vulnerable. And you'll see that since you all began providing us support, we were able to have the staffing and resources we needed. We more than doubled the number of men that we were bringing to us from shelter, which is really remarkable. And that is more than doubling it, even with the fire that we experienced at Fort Collins Rescue Mission. With all of the other difficulties and problems, we were still able to more than double that figure with your support and help. Next slide.
I think Zoom just crashed.
So we crashed Zoom?
Yeah.
Impressive. If not,
I can still hear. I don't know if we're crashed. Can you not hear us or see us?
Still lag.
Do you want to use mine?
Sure. Yeah. I don't get the wildest thing about this. So Fort Collins Rescue Mission is the next slide. And again, this is all related. We had a fire back in August, and still these are some of the numbers that we were able to work through, again, with your support. 27,507 nights of shelter, 3,412 auxiliary shelter nights, 684 unique individuals served, 300 of which were new to Fort Collins Rescue Mission, and 62,884 meals served, meaning we are certainly one of the largest kitchens and meal service providers in northern Colorado. What you all were able to help us provide, I don't know if you guys remember this, but when we first came in and asked for this funding and support, we were in a position with, due to COVID and other circumstances, we were looking at not being able to, we were looking at not being able to provide 24/7 shelter. And this council stepped in and provided a significant amount of support to us so we could continue that 24/7 shelter. We've still had 579 case management appointments, 190 plus men who attended groups with us, 71 entered into more stable housing, and 81 connect or refer to a mental health provider. So if you look at the numbers from Fort Collins Rescue Mission and Harvest Farm, it's 71 who entered into more stable housing from Fort Collins Rescue Mission, over 90 who entered into more stable housing from Harvest Farm. And that's a joint and very collaborative effort between the two of us. Next slide, please. Successes and challenges. There's always those. Successes, we realized pretty early on that if we were going to serve those most vulnerable, we need to serve them at their point of need. So we started through funding from the ROAC. We had a dedicated intake specialist who not only went into the community, went into our shelter, but brought men up to Wellington so they could tour Harvest Farm before they had to make a big decision like committing themselves to be there for a year. So we were able to afford them the same opportunity that any of us would have if we were looking for resources. And that's, and I'm going to go and physically see it before I commit to that. And that's something you all helped us provide, which was tremendous and had a huge impact. improved the Fort Collins Rescue Mission Harvest Farm relationship. We increased our partner engagement. We engaged with Porch Light Clinic, Salute, Summit Stone, specialty counseling, wellness, psychiatric care. And again, we're able to, through good relationships and partnerships, have all of them come on site. So that way, those most vulnerable experiencing homelessness receive the same quality care that they would have at any other program. Challenges, of course, we had a fire in August, as you all know. I won't show pictures, you've seen them enough. It was bad, it continues to be a difficulty of ours. And then accessibility to Harvest Farm. Accessibility, when I say that specifically, I mean those with disabilities, with mobility issues, transportation issues. Harvest Farm, for those of you who have toured, which is the majority of you, is beautiful, wonderful, and lovely. But 100 acres if you're wheelchair bound, and a quarter-mile walk from our dining hall to our dorms 3 times a day was and is a challenge. Next slide, please. So what have we learned? We've learned that throughout all of our work at Denver Rescue Mission, whether that be at the new Homeless Resolution Center that we're building now, when it was at Harvest Farm, is that we need to reduce barriers and increase accessibility for everyone. Oftentimes, I believe the mistake is looking at clients and saying, what kind of clients do we need? And let's cherry pick those, as opposed to saying, really, what do we need to do as an agency to ensure we meet those needs? And in what ways do we need to humble ourselves and invite good partners in so that way we can serve those in need? ADA accessibility, expand equitable access to care. Again, this council's funding support was to provide ADA beds, of which we did and built. Sadly, we won't be able to use those to the extent that we had planned and hoped. Access to transportation and community resources increases retention as well as participation. Simply put, having community transportation available, like a bus system which exists in Fort Collins but not in Wellington, is an incredible benefit to those who otherwise don't have access to transportation. And then lastly, we need to have trauma-informed environments. We need to have environments that are designed for those we serve as often as we can, as opposed to retrofitting previous environments. So I say all this to say, I've come up here a lot over the last years. I came up here at the beginning of the ROAC's inception. I believe we were one of the first applicants. And we've learned a lot and we've grown a lot. And it's our intention to carry all of this over into our new Homeless Resolution Center, which is slated to open up in January. I will say certainly, I wish we were doing it in tandem to the Homeless Resolution Center. And that's the wish of our entire organization. And yet it's still our intention that we want to do what we started doing 135 years ago at the Denver Rescue Mission, and that's serving those most vulnerable in our community. And that's as true now today as it was when the Denver Rescue Mission first started. So that's it. That's my final report. Questions?
Questions for Kyle?
That's a lot of assistance, so great work.
Thank you. Thank you very much.
Kyle, I don't have a question, but I would just like to give you a little bit of kudos and tell you a quick story. I have 2 friends that have gone through Harvest Farms. Both of them were referred to Harvest Farms through the justice system, and they are both now married. They've purchased houses and have children with healthy families operating in Loveland. So I really appreciate your work with Harvest Farms through the years.
Yeah, thank you.
Thank you. That was it. Yeah, we'll make a motion on this final report.
I'll move to accept the final report.
There's a motion.
I'll second.
Motion and a second. Any further conversation?
Just, Mr. Chair, I just wanted to tell, I think Seth and Kyle are in the room. I'm sorry I'm not there in person, but I just wanted to thank you for the work you've done, and until next time, we'll talk soon. Thank you.
Thank you. Thank you very much.
Does anybody oppose the motion? Hearing none, it passes unanimously. Thank you, Kyle.
Thank you all so much.
All right, Rise Above, their final report.
Good afternoon. I'm Kent McLennan, the Executive Director for Roosevelt, Colorado. I'm going to give Heather a shout out for catching that we had old slides in here that she found like 90 minutes before the meeting. So I think we have the current ones in here. So thank you so much for catching that note. So happy to provide our final report. We can go to next slide. So just a reminder of the focus of these two objectives for this past year. Continuing to deploy the Connect Effect Fentanyl Awareness Messaging Campaign to youth 10 to 18, and then also deployment of school-based opioid and fentanyl prevention resources in the 3 school districts of Larimer County, building on that work from the previous grant cycle. So go to next slide. So we're going to dive into the Connect Effect a little bit. We've seen some really great numbers. The campaign ran in November and then from January through April. So that's the primary period in which the messaging campaign was delivered. You'll see that we're about just under 2.7 million impressions with this campaign, and over 27,000 clicks that took youth back to the Connect Effect website. Just a reminder, all this is localized content, so that ad messaging that they saw reference data for Larimer teens based on survey data that you all helped us collect from 2024. We had some really great engagement with that. Snapchat and Instagram were the primary drivers of that, and where we were actually seeing double the industry standard in terms of the engagement rate, so that click-through rate. And so that's really exciting to know that the messaging continues to resonate and get youth's attention. I do want to mention, related to this, the data that we are currently collecting, our survey that is being facilitated by Healthcare Research as a third party, is currently in the field. I think data collection should be done any day now. So later this fall, we will have new results from the 2026 version of the survey. So we'll have some data to compare to what we saw in 2024, track trends, and look at that, as well as take the data that comes from that new survey and update our content here in our new grant cycle. So the data points that are in these current ads, we'll be able to update, we'll be able to refresh and give it a little bit of a new fresh look along with those data points. So more to come there. We'll likely have that, and the data will be publicly released in October. So that is tracking. Next slide. I wanted to just give you a sense of the sort of the reach beyond just those numbers. Our media buyers able to look at they have some methodologies for looking at the estimated reach of the number of Larimer County youth that saw the messaging. So this quick little table there shows they're estimating that of the 30,000 estimated youth population of the county, that we're seeing somewhere between 22 to 25,000 youth that were receiving that message. That's between 74 and 84% based on their methodology. Their goal is really, as long as we're seeing 70% or more that are repeatedly seeing these messages, that's when you can start to anticipate over time some attitudinal and behavior change. So we're hitting the marks there from the campaign as part of this approach. So really happy about that. Next slide, please. Second piece, our second objective around prevention resources. We were really happy over the course of this past year to be working on the update of the primary resource that we've been using with this grant, which is our not prescribed prescription drug misuse lesson. It's a single day science and standards-based resource that takes about 60 to 90 minutes to facilitate. We actually worked with Fort Collins High School, was one of their health educators that worked on a committee of educators to help revamp this lesson. It just launched in February, so our numbers are admittedly down from where they were in our previous year. As you may recall, we had Poudre School District had all of their health educators trained and really it's close to a mandate is they were able to ask the health educators to facilitate it. We had 2,400, I believe, in the spring of last year, so our first year grant. This year, we only had 400 students go through that new lesson, so we do anticipate that to jump back up to where we were, because we will be doing a full training in October with those health educators that received it once, and now they're going to get retrained with the newer resource. So I think that's promising. We're going to do retraining as well with Estes Park health educators. We've not had success with Thompson School District to this point. They weren't really interested in using this and engaging in a deeper way to get additional training. So it's really up to teachers individually. We'll continue to put our outreach out there and try to encourage them, especially with this new resource, to utilize it. And the resource itself continues to show strong impacts. I noted a couple of bullet points of the sort of before and after increases around knowledge about about misusing prescription drugs and their ability to have conversations and support or advocate for this issue with their peers. So those are, again, some positive indicators of the impact of the lesson itself. I think that is everything, and I'm happy to entertain any questions.
Questions from the council?
And the presentation that you gave was different than was in the packet. That was last year's.
That was last year's results, and we noted that there is no carryover request that was in there, which is how Heather caught it. So apologies for how we got.
I figured it out after a couple of slides.
Yes, so my apologies that we got you an old file.
That was good though, because I was able to see 2 years worth.
You're all caught up.
Yeah, we're all caught up. Good.
Commissioner, I see your hand up.
Thank you, Mr. Chair. And I have to say, I still talk about the data that was shown at the conference in 2024. It was just outstanding data. So my first question is, if I could ask you, Mr. Chair, is do you have any a way, or is there any way to track kind of some of those folks that responded in 2024 to the next round? Or do you think there's just really hard to capture those same cohorts about if they're still kind of feeling the same way as they had in 2024? That's my first question. And then the second question is, I know I'm kind of disappointed to hear about Loveland and Thompson school districts. I know we had a lot of help from the co-responders and the SROs in the school districts to get those posters up and get the kind of the connection throughout the schools. Do you think there's a need? I'm going to be having a meeting soon with a joint group, including the school district, and I'm wondering, is that something that I could bring up or discuss, and wondering if there any opportunity to see if we can open that door again? I'm curious about that. Thank you.
Thank you. Let me take your second question first and say, yes, I would love for any help that you're able to offer in sharing some of the impacts and what we've seen with the success with the lesson in Pooter and other locations. So I'd be happy to provide you whatever information so that you feel comfortable being able to share more and then engage with whomever wants to pick up the ball and run with it. The impact of somebody in community that wants to share it would be super helpful. So thank you for that. And to your first question, the survey does not it is not sort of longitudinal with respect to individuals. So it is a sampling of roughly 30 to 40 youth that are in that same age bracket, 12 to 17 from Larimer County. So it is not going back to those same youth to see what we can see about changes in, sort of on a more individual level from that perspective. So, and that's true with our survey across the board. Larimer's no different in that regard, unfortunately. So, and I would also say the same is true with anyone that might be doing the lesson. We do try to do pre-post, which is to give us a sense of what does change, as an impact of the lesson itself. But on the survey data, no, we can't say anything more than some, make some inferences based on the size of the sample. And like I said, I would be happy to come back to, and if there's a data subcommittee or folks that want to dig into the actual findings, I'm happy to share that at any point that the council would like. Because you will help make it happen in the grant.
Thank you very much. And please, maybe Heather can get you my email. I've got my hands full with a lot of things, but I certainly would love to help you if I can. And thank you for answering my questions.
Would you love it? Thank you, Commissioner.
Questions or comments?
I'll make that motion, Mr. Chair, if there's no more questions to accept this final report.
Second that.
Motion second. Any further conversation? Hearing none, does anybody oppose that motion? Hearing none, that passes unanimously. Thank you for all your work.
Thank you. I will give a shout out. We got a chance to work with Laramore County Public Health. One of my colleagues did a podcast on their healthier. And now I'm forgetting the actual name of the podcast.
Healthier Larimer.
Healthier Larimer. Just about a month ago. So
Wonderful.
happy to share that out for anyone that's interested.
Oh, good. Thank you.
Thank you all.
Okay, before going to 6, I just want to just sit here listening to all these final reports, and I remember back to 2022 when we were talking about the work around the council's work with opioid abatement. We talked a lot about prevention, harm reduction, stigma reduction, treatment and housing, ultimately recovery. And every one of these, when you put them all together, covered a piece of that. And when I learned a lot over the last few years, you have to have the full continuum. You have to start with all of those aspects, and preventions within all the aspects, whether that's treatment or recovery and harm reduction as well as stigma reduction. So it's just a privilege to be part of this council, privilege to work with the many of our wonderful grantees and colleagues and nonprofits and for-profits in the community working in this space. But I'm just blown away, and it resonates with me. Wow, the work we're doing to save lives and then get people on the track where they're just productive, resident, and free from substance use abuse. But I just wanted to acknowledge this, and it resonated with me that we're going through this. So hats off to all of our work. It's a great
Well, that resonates with me. For 2 years, first 2 years of my term, I had one of my trustees sitting on this, and I could recognize the value and seemingly even increasing value of what this committee was doing. And when she left the board a few months ago, I very much wanted to be part of this because it is such a significant effort.
So thank you for sharing that. Okay, moving on. Commissioner update on advisory member with experience. I know you've been working on that.
She's muted.
Yeah, Commissioner, we were looking at agenda item 6, that's the update on the advisory member lived experience. I don't know if you can hear us, if there's a connection issue. I got a call. Well, I do have a couple updates. If it's okay with the council, I'll give those updates and we'll see if Commissioner rejoins us to give that update on 6. I will turn it over to Rupa. She wants to make an announcement.
Yeah, so this will be my last ROAC meeting. With some reorganizing that our city is doing, we were able to promote Jacob Castillo, who was the Chief Sustainability Officer. He's getting promoted into an Assistant City Manager role. And that's already effective, so I'm not like spoiling anything. And his role will be to oversee community development, housing, and sustainability. And part of sustainability is human services funding. So he was Beth Jansa's previous supervisor. And so he'll fit really well into this council. So it's been awesome, like hearing all the great work that our organization, our nonprofits are doing. So it was fun. I'll still be around. But I think you guys will all really enjoy Jacob. And Jacob's a familiar face to the county, so he's really excited. And I did talk to him about the secretary role, and he is willing to take that on, but I know that will be talked about in July.
Well, Rupa, thank you. You will be missed. Appreciate your involvement on this council.
Yeah, of course, it's fun.
Yes. With that, it does open up the secretary piece that Rupa's been so well fitting into that. So in the next meeting, we'll have to select a new secretary for the council. But thank you, Rupert, for that, and we welcome Jacob Steele. Commissioner Yett.
I just wanted to give you all a heads up. I'm hoping to nominate Mayor Gary Hall for that position at the next meeting, just to give you a heads up. Thank you.
Okay, Commissioner, we can go back to items, agenda item 6, update on advisory member lived experience.
Apologize, I had to just step away to use facilities. So I wanted, we only got one application, and I have been trying to reach out to that individual to have a phone call. To be honest with you all, I was away for over 3 weeks at Harvard Kennedy School of Government, which is where you're at Harvard and immersed classes for 14 to 15 hours a day. And then, as you know, we had one of our board members lost a child, and we lost two deputies and a family member. So we have 2 funerals back to back next week. So the last 5-6 weeks have been pretty packed and emotional. So I'm hoping to get a hold of them, and by the next meeting have them. Hopefully we can approve that person, but we only had one application. So I think they have some great qualifications, but I thought I would still ask them the same questions that we asked the other members, and hopefully have them to be approved and maybe attend as a community member or something for the next meeting in July. So just wanted to give you that update. We've just been playing a little phone tag, but I'm going to keep trying.
All right, thank you for updating. Any questions on that, council? Well, it'd be great to get a lived experience back here on these meetings because it's so valuable. So I'm looking forward to person on there. Just another last announcement. We did receive, Janelle sent an email that we received a check from Harvest Farm for the full amount, $510,020. So that money has been brought back to the Roy. I do appreciate the Harvest Farm and all they have done to our community, as well as the resubmittal from the letter. So that will be back into Roy budget, where we can have conversations on where we can utilize that money to continue the great work of prevention, harm reduction, stigma reduction, treatment, housing, and recovery. So get that update. Any other updates? Not all. Push to adjourn.
I'll second.
Anybody oppose that? Thank you for all your work. It is a jury this time. Thank you. Everybody have a great rest of your week.
Senator, I let Jacob know. I let Jacob know about the secretary. He's on it.
Oh, yeah. That
But
will
he'll
work
send it.
out. Not worried about that.
Yeah.
Good to meet you.
Yeah,
We're
good to
gonna
meet you.
do for approved time.
Yeah.
How long?
That's very city. Oh, I'm still in this. Yeah.
Wow.
So it's not, it's just, as long as.
Yeah, did I stumbled around?
Yeah.